Hi everyone, my name is Ken Aguirre, and now we're going to talk about a randomized controlled trial of liraglutide for adolescents with obesity. Definition: obesity is considered a disease since excess weight leads to major health problems. An obese person is a risk for diabetes, high blood pressure, and heart disorder, among other complications. Obesity occurs when the adult body mass index exceeds 30 kilograms per square meters. It can affect both men and women of any race, nationality, or social stratum.
Obesity is a condition that is associated with having an excess of body fat. Obesity is classified as having a body mass index of 30 or greater. 3 decades ago, the obesity rate for adults was 15%. Today, the rate has more than doubled to 35%. At the same time, calories consumed by adults have gone from 1,996 to 2,234 a day. Obesity-related conditions include heart disease, stroke, type 2 diabetes, and certain types of cancer. These are some of the leading causes of preventable death. The estimated annual healthcare costs of obesity-related illness are $190.2 billion, or nearly 21% of annual medical spending in the United States. Obesity-related job absenteeism costs $4.3 billion annually, and obese people spend 42% more on healthcare costs than healthy weight people. African Americans have the highest age-adjusted rates of obesity at 47.8%, followed by Hispanics at 42.5%, Caucasians with 32.6%, and Asians at 10.8%. There's no significant relationship between obesity and education among men. Among women, however, there is a trend. Those with college degrees are less likely to be obese compared with less educated women. Higher income.
Now I'm going to talk about the application in medicine. And liraglutide is a medicine that is used for treatment of type 2 diabetes mellitus and obesity. It is an analog of incretins, so it acts the same way as a natural incretin. They are released by cells of the intestine in response to food intake.
Welcome back to Meds Made Easy. My name is Tarun Verma with Telfair Specialty Pharmacy. Today we're going to talk about liraglutide, also known as Victoza, also known as Saxenda. Two different purposes though. Victoza is for people with type 2 diabetes mellitus, or just diabetes. And Saxenda is for people who are trying to achieve chronic weight gain management, essentially. Control your weight. So, how does it work? So it does separate things. It gets really difficult to explain all of it, so I'm going to go with the two most prominent things that it does, which is it increases glucose-dependent insulin secretion. So depending on what hits the body, so it's in direct response to the food you eat. So, it'll increase insulin secretion depending on how much you've eaten. If you've eaten a lot, it'll secrete more. And essentially insulin is what keeps our blood sugar down. And then also what it does, and this is one of its special caveats about this medication, is it has decreased gastric emptying. So let me explain that. So when you eat, if everything were to go straight into your intestines would immediately, your intestines are like sponges. They just soak up all the nutrients and whatever you're eating, and it shoots it into your bloodstream. So by gastric emptying, meaning if we slow down the stomach, because the stomach, first the food goes, through our mouth, down our esophagus, into our stomach, and then from the stomach, it slowly empties into our intestines. So if we can slow down the food being in the stomach, one, it'll make you feel full quicker. Two, it will cause less of a sugar spike in your body because it's slowly releasing just a little bit of food at a time. So our body is able to quickly process it and then get ready for more, and then get ready for more, and then get ready for more, instead of a whole bunch of food just coming down all at one time, and then your intestines are just soak everything up, and that's not good because then it'll shoot everything in your bloodstream. So,
Pros and cons. Liraglutide injection is used with a diet and exercise program to control blood sugar concentration in adults and children 10 years of age and older with type 2 diabetes. It is also used to reduce the risk of heart attack, stroke, and death in adults with type 2 diabetes and heart blood disease. Liraglutide injection may increase the risk of developing thyroid gland tumors, including medullary thyroid carcinoma.
Liraglutide is a glucagon-like peptide 1, or GLP-1, analog used to treat patients with type 2 diabetes. It lowers blood glucose and is associated with weight loss, blood pressure reduction, and an increase in heart rate. In a multi-center study, investigators randomized 9,340 patients who were 50 or older, had type 2 diabetes, and were at high cardiovascular risk to receive either liraglutide or placebo in addition to standard care to assess the potential effect on cardiovascular outcomes. At baseline, over 70% of the patients had cardiovascular disease. The mean duration of diabetes was 12.8 years, and the mean glycated hemoglobin level was 8.7%. At 3 years, the mean glycated hemoglobin level was 0.4 percentage points lower in the patients receiving liraglutide than in those receiving placebo. With a median follow-up of 3.8 years, fewer patients treated with liraglutide experienced the primary composite outcome of first occurrence of non-fatal myocardial infarction, non-fatal stroke, or cardiovascular death. This reduction in the primary outcome was driven mostly by fewer cardiovascular deaths. There were no significant differences in the incidence of adverse events, but patients receiving liraglutide had increased rates of acute gallstone disease.
Issue applied in Ecuador. A total of 125 participants were assigned to the liraglutide group and 126 to the placebo group. Liraglutide was superior to placebo with regard to the change from baseline in the BMI standard deviation score at week 56.
My name is Lotte Bjerg Knudsen, and I work for the pharmaceutical company Novo Nordisk, which is located in Copenhagen, Denmark. The purpose of the study that is presented here in this article was to study the mechanism of action for liraglutide in weight loss. Liraglutide is an analog of human GLP-1 that has been engineered to have a long half-life so that it is suitable for once daily injection to patients in a simple pen device. And liraglutide has already been approved for the treatment of type 2 diabetes, but is now in clinical development for the treatment of obesity. We know that liraglutide lowers body weight in humans by increasing feelings of satiety and decreasing feelings of hunger, leading to a lowered energy intake. So the study questions that we asked ourselves here is, does liraglutide enter the brain following peripheral administration, and which GLP-1 receptor expressing regions in the brain are the target for liraglutide, and how are the classical appetite regulating signals affected by liraglutide treatment? When looking at the classical appetite-related signals, we used a rat model where we compared liraglutide not only to a normal control group, but
The conclusion. In adolescents with obesity, they use liraglutide 3.0 mg plus lifestyle therapy led to a significantly greater reduction in the BMI standard deviation score than placebo plus lifestyle therapy.
Obesity. What does that word make you think of? Excess weight? Unhealthy food choices? Limited physical activity? Healthcare burden? Perhaps, but they're only part of the story. Obesity is a serious problem for world health, and today it affects over 600 million people. But there is a science to obesity that is complex and frequently misunderstood. In simple terms, obesity develops when we consume more calories than we expend. Over time, excess energy gets stored as fat in adipose tissue, causing weight gain. Losing that weight and keeping it off means more than just eating less and moving more. The thing is, our energy balance can be influenced by many different factors, including our physiology, genetics, environment, socio-economic status, and psychology. And then there's the body's homeostatic system, which controls appetite, energy intake, and energy expenditure. It involves several areas of the brain, including the hypothalamus, which processes hormonal and neuronal signals from other brain structures, the gastrointestinal tract, and adipose tissue. Weight loss alters this system, causing the body to increase hunger and lower the metabolic rate. The stomach also releases more of the hormone ghrelin, which serves to heighten feelings of hunger and the desire to eat. At the same time, the gastrointestinal tract, pancreas, and adipose tissue release fewer satiety signals, so the brain doesn't recognize feelings of fullness. Hormonal shifts like these are partly why people who do lose weight often put it back on, despite their best efforts.